Mr. President, I'm also here to talk today about the work that's being done to help my home state of Ohio get through this coronavirus. It's a crisis in so many ways. It's a healthcare crisis, but it's also become an economic crisis, a family crisis. It's affecting everybody in ways that are truly heartbreaking for me to see in so many instances. I've talked to people who have been unemployed for the first time in their lives and have never had to access the unemployment insurance office. They've been fortunate, and now they have to. I've talked to people who have started a small business and took a big risk to do that and have 5 or 6 employees. It's a family-owned business, and they've been through thick and thin over the years. But this one has really knocked them out. They have no income coming because they're in one of these businesses that by government order was shut down and cannot continue to serve the customer. I've talked to hospitals in a rural area of our state that cannot continue to operate. They've got about a week left of cash reserves. Luckily, they're going to get some of this funding that Congress just provided with regard to the Phase 3.5, as we're calling it, legislation, the CARES Act. But they're really hurting. They have had to lay off more than half of their hospital staff. They can't do elective surgery. They can't have the normal work they're used to because people aren't coming in to see the doctor. They aren't coming into the emergency room. Now, again, the good news is that in Ohio and in some other states around the country, we're starting to open up and doing so safely, doing it with more testing, and that's all good. But it's been a tough time. Like so many Americans, I've been on the phone a lot. I've been on the phone pretty much all day, every day, and into the night. And a lot of what I've been doing is talking to constituents and talking to stakeholders across the state and hearing their concerns and trying to explain what we're doing here in Washington, how it would affect them and their families, and getting their input as to what we should do. But also, I've been working with the White House and HHS, FEMA, the FDA, the Federal Drug Administration, Treasury, the SBA, the Bureau of Prisons, the U.S. Trade Representative, the state of Ohio, and others on corona-related matters to be able to help Ohio companies and help Ohio individuals. And we've had some success in that, and I'm proud of that. In terms of constituents, we've held 7 tele-town hall meetings in the last 6 weeks where we hear directly from people, thousands of Ohioans. And again, a lot of heartbreaking stories, and also a lot of really inspiring stories about people who have stepped up and helped. One guy lost his job and decided to go volunteer at a food pantry. And he wears the PPE, the mask, and the gloves, and he delivers food to people who have never had to worry about food security before because they've always had a job. Now they don't have a job, and they're waiting to get their unemployment insurance, and they can't put food on the table. Some of them feel funny about going to a food pantry because they've never done that before, and he makes them feel more at home, he said, and understanding and more welcome. I've talked to people who are delivering groceries to their neighbors who are seniors who are more vulnerable. God bless them. I've talked to people who are making homemade masks at home. I brought some with me on my trip to Washington, and they're doing it as volunteers, not asking for anything other than just that if you take this mask, you have to agree that you're also going to be helping your neighbor. So the frontline workers, the hospital workers, they are putting their health care on the line for us. So they're risking their own health care and the possibility of getting this virus to help all of us, and to help our grandparents and our parents, and God bless them. And I love when the healthcare workers are being held up by everybody. Today is, I think it's official Nurses Day today. We should all be thanking our healthcare professionals, and specifically today our nurses, for what they do every day in every time period, but particularly during this crisis where they've been working really long hours and doing everything they can to try to protect us. I appreciate the people who are doing everything else on the front lines right now, whether you're working in a grocery store and stacking shelves or whether you're driving a truck. I drove my pickup truck from Ohio to Washington on Sunday to be here for this week, and every time I went by a truck, I said, thank you, just for being out there and delivering the food and delivering the products. So we thank those folks for what they're doing, all of them. And so one thing I've tried to do is to help in terms of explaining what's going on and getting input. We've talked to more than a dozen groups out there. I talked to the Farm Bureau today in Ohio, but I've also talked to the hospitals, small business owners, food banks, the nonprofits, and many others to hear how we can support them during this tough time. This afternoon we had a telephone call with some of the largest businesses in Ohio, and a group called the Ohio Business Roundtable, and they talked about some of the things they're doing. Some of them are essential businesses to keep their employees safe, and of course I encourage them, as I always do, get your best practices out to all your other business associates. Let them know how they can reopen safely, because we're starting to reopen in Ohio. We want to be sure it's safe. And the best advice is not going to be from some piece of paper of guidance, as important as that is, from the White House or from the state of Ohio. It's going to be from other businesses who have found out that, hey, guess what you can do? You can stagger the lunch break. That helps to spread people out, things that might not be obvious. Do the temperature testing as people come in. Be sure that you're doing everything you do to explain to people what they can do if they feel like they're getting sick, who they can come to, and how they can be sure that they're not infecting others. So I think there's an opportunity here to be able to reopen and do it safely. One reason we're able to reopen in Ohio safely is we have a lot more testing now. Like many states, we didn't have enough testing until very recently. Now we're getting it. We had about 3,700 tests per day 2 weeks ago. Within 2 or 3 weeks from today, we'll have 22,000 tests a day, a 600% increase. And we had to work at it because we were having trouble getting some of the components for testing, particularly the reagent. And the state of Ohio, to its credit, with Governor DeWine, reached an agreement with Thermo Fisher, a private sector company, to take the lead in providing us a guaranteed supply chain of this reagent under their test, which enables us to dramatically increase our testing. And we're getting to the point where you can have a lot more drive-through testing. So at Kroger and at Walmart and at some of our drugstores, we're starting to get the testing that's much easier for people because you can drive through and don't have to get out of your car and you feel safer. The saliva test, as opposed to a test where they take a swab deep into your nasal cavity, is a lot less intrusive, and that's starting to be used more. So we're beginning to have enough testing where we can more safely say, look, we're going to reopen, but we're going to test people a lot. And then if we find a problem, we're going to do the contact tracing to figure out who that person has been with and quarantine those people. That's a lot smarter than quarantining everybody else. All of us is to really test where there's a problem. And to get to the point where we can test people who are even asymptomatic. Why? Because even if you don't have symptoms, you could be a carrier. And so I think dramatically increasing the testing is a key thing. This is the diagnostic test. There's also the immunity test that's coming up, which is also helpful, but nothing replaces the diagnostic test. It says whether you have it or don't. We also are seeing good news in Ohio and around the country on these antiviral medications. And that's one reason we can reopen more safely, too, because if someone does get coronavirus, they now have a chance to take something, like Tamiflu you take for the common flu. And so remdesivir, this most recent one that the FDA has approved, has a record of being very helpful. People want to know that if they get the virus, they can take something for it. That's helpful. And then finally, we are getting our hands around the PPE issue, the personal protective equipment, the masks and the gloves and the gowns. This afternoon, this evening, after this talk, I'm going to be working with an Ohio company that is interested in dramatically expanding the gown production. That would be great. And we're working with the White House and others to try to ensure that that can happen. We have a lot of great world-class businesses in Ohio. The one I'm talking about tonight is an example of that, but there are others too in healthcare systems that have contributed to this coronavirus crisis all over the country. And I've been working the last 6 weeks with them, being sure that they have the opportunity to do that. One of those key contributions from Ohio has been from an entity called Battelle. Battelle is a global research institution, and it happens to be headquartered in Columbus, Ohio. They do awesome work all over the world. They run some of our national labs, for instance, for the Energy Department. We worked with the Trump administration and with Ohio Governor Mike DeWine to help them get approval for a really innovative technology where they can take a mask, an N95 mask, one like this, except even better because it's N95, and they can recycle that mask. They decontaminate it. These masks can be recycled up to 20 times. Think about that, 20 times. It's groundbreaking because they now have enough machines spread out around the country, 60 machines, that they can recycle, decontaminate between 4 and 5 million masks a day. I worked with FEMA and HHS in the White House to help Patel secure a contract with the federal government to be able to do that, to take their technology, their machines, and spread them to initially hotspots around the country, like New York and Boston, Chicago, Detroit, now other places. I would tell people who might be listening that if you are connected with a healthcare entity, a hospital, a nursing home, EMS, if you're a firefighter, and you use these N95 masks, don't throw them away. When you're done with them, put them aside in a separate bin for recycling and get them picked up. We also worked on a contract with the federal government to help with the pickup and delivery, which is also available now. You can get them picked up, taken to Battelle. Hopefully they have a cleaning station near you, and for free, get a recycled mask back. The process takes about 8 hours. So if you're close to one, you can get them overnight. But we're not at full capacity on these machines. We should be. It's a great idea. Why spend the money to get some overpriced masks from China, because they're all overpriced now, when you can actually recycle what you have? It's a lot less medical waste, too. So if you're interested in that, go to battelle.org, learn more about it. Go to our website, portman.senate.gov, if you want to find out more about it. Find out if there's a machine near you. Even if there's not, you can send them, and we can help you connect you with companies, including Cardinal Health in Ohio, that are providing some of the logistics to get the masks back and forth. But that's an example of some of the things we've been working on over the past 6 weeks to try to help with this effort. And I want to, again, as I've done before, commend the folks at Battelle for devoting their time and energy to this project. As soon as this coronavirus came up, they said to the engineers, forget what you're doing, go work on this. They've also done a lot with testing with Ohio State, putting their folks against that. Now they're working on some other really interesting technology that could be very helpful in detecting coronavirus. So it's an example. We had another company, Cardinal Health, I mentioned, that are helping in terms of the logistics, that did something else early on. They came to me and said, we've got 2.3 million protective gowns in storage. We're not using them. And they are the kind of gowns that can be used as isolation gowns, very effective. They're not qualified as surgical gowns, but they can be used as isolation gowns. We're willing to donate them to the national stockpile. Well, we worked with, again, FDA and HHS and the White House to get through some of the red tape, because it's tough to get things approved sometimes through the federal government. There are reasons for that. Want to be sure things are safe, right? But we got approval for those gowns. And bingo, like that, those gowns started to go out. They went to New York. They went to Detroit. They went to places where there were hot spots. And they're now in the national stockpile, 2.3 million gowns donated. So Ohio companies have been helpful. One that's been very helpful to so many Americans is Gojo. It's a company that makes Purell. I see some up here on the desk. Purell is made in Ohio. It's outside of Akron, Ohio. We're very proud of Purell. They've been going 24/7, producing all they can. It's tough to find it in the grocery store, I know, because as soon as the shipment comes in, people take it and take it home and use it. And it's particularly helpful now to have Purell out there as we're beginning to reopen, because reopening means doing things differently. It means wearing a mask when you're in proximity with someone else. It means using Purell and washing your hands more often. It means being sure that you're following the rules to be able to stay safe. So Purell will continue to be needed. But they had a problem, because the federal government was assessing a tariff, 25% tariff, on 2 critical items they had to have for their dispensers. The items, at least one of them, had a patent in China, so China had the patent on it. So these were coming in from China, 25% tariff. We were able to go to the U.S. Trade Representative and I commend Bob Lighthizer, who is the trade rep, for working with us on this, and for this period of time to take that 25% tariff off. Why? Because they were having a tough time getting the supply, and because it was increasing the cost by 25%. And we were able to do that, and now they're able to produce more of this Purell and more dispensers and do it less expensively. By the way, this leads me to comment on China, which is that we need to pull back some of what we make in China and make it here. It's a pretty simple concept. It's harder to implement sometimes because our supply chains are global now, and they're complex, as you can imagine. You know, who would have thought that in a Gojo dispenser for Purell there'd be a Chinese patented product, but there is. But we have to figure out whether it's gowns, most of which are made in China, or masks, or other products like something essential that's in a hand sanitizer dispenser. We've got to pull those products back. And I think the way to do it isn't to beat up on China, but rather to provide the incentive, the carrot, to American companies and other companies to say, make it here, make it in America. And I think we can do that as a group, Republicans, Democrats alike. I think there's a consensus now we should do more to reshore, in some cases shore for the first time, products that have been moved overseas and particularly to China. We wouldn't have had to get that special permission on the 25% tariff if it was made here. We also worked with the FDA to get approval for a company called Second Breath in Cleveland, Ohio. Another great example, and there's so many in Ohio, but this is a company that didn't make ventilators at all. It's actually a consortium of several manufacturing companies that work together, but they, again, early on in this crisis said, you know what, we need ventilators. We can do that. We're manufacturers. We're Ohioans. We're inventors. And they went out and they made these ventilators on their own that were then tested at 3 different Ohio hospitals. And the medical community loved them. And they're relatively inexpensive, relatively simple, and very effective. But again, the FDA had to go through its process. And my job was not to say to the FDA, you need to approve this. My job was to say, please expedite this process so that if it can be approved, we can get these out to people who are dying, literally, and need these ventilators. And to the FDA's credit, Dr. Jeffrey Shuren in particular, they worked with us and got that product approved. And now those ventilators are going, and by the way, they'd already made a bunch of them. They weren't going to send them out if they didn't get the approval, but they didn't care because they were willing to take a loss with the opportunity to save people. And now those ventilators, boom, have gone out to stockpiles and to hospitals, including to New York, when they needed them all over the country. And so it's an example of the kinds of things over the last 6 weeks we've been able to do in Ohio. There's also companies in Ohio now making swabs, making masks, making shields, face shields, making hand sanitizer. The Procter & Gamble company has converted some of their perfume-making factory to making hand sanitizer. It probably smells pretty good, but I don't know if it actually has a particular odor to it, but if it comes from a perfume factory, it might be not just effective, but smell pretty good too. So anyway, thanks to Procter & Gamble, thanks to all these companies that are willing to step up and do things they've never done before and to respond to this crisis. That's what Americans do. We get knocked down, we figure it out, we get back on our feet. And so ultimately, I'm optimistic. Think about what's happened in the last couple of weeks. Substantially new testing. In my own state of Ohio, again, a 600% increase in testing from 2 weeks ago to 3 weeks from now, increasingly ramping up. New antiviral medication having been approved, something that people can rely on. More testing and antiviral medication critical, more PPE. Finally, we're figuring it out, like the recycling, which we can do right here in America, recycle our own masks. The gowns we're trying to get produced more here in America right now. We're starting to catch up on some things that, frankly, we were pretty far behind on. On the testing, I would tell you, for the first few weeks of this crisis, you couldn't get a test in most parts of Ohio unless you were so severely ill you had to be hospitalized. That was wrong. And we just weren't prepared as a country. And by the way, the last administration wouldn't have been any more prepared, nor would the previous administration where I served have been any more prepared. We just were not expecting a pandemic like this. We should have been, of course. There were some warnings. But the country now will be prepared. And one thing we're doing is we're adding to that stockpile with the PPE, with the ventilators, with, obviously, the antiviral medications for this virus and the vaccine for this virus. And my hope is that that vaccine, which is, the administration calls their process warp speed, and I appreciate that. They're working around the clock. There's some scientists that have devoted their lives to this now. That's all they're doing. And God bless them, and there's a bunch of them. And by the way, some of these vaccines won't work. And people will have spent hundreds of millions of dollars, even billions of dollars on stuff that's not going to work. But kind of like those ventilators were made, even though they didn't know if they were going to get approval or not, we want to have that virus vaccine ready. And if it does work and it gets approval, we want to have lots of doses of it already made. So there's going to be some money spent, including by the federal taxpayer, but that's okay, to ensure that we end up with something that really can be effective. On the testing, I would tell you, in my own hometown of Cincinnati, Ohio, those first few weeks we really couldn't get tested unless you were to be hospitalized. And we had an interesting issue there, again, showing how Washington sometimes can make things a little slower. The University of Cincinnati, which is our primary academic medical center in southern Ohio, had ordered a testing machine back in February. They'd ordered it because they knew this was coming and they wanted to get the best of the best. So it was a high-quality machine, high accuracy, could do 1,000 tests a day. And by the way, at the time, they were doing about 80 to 100 tests a day in their own little lab. But they needed this equipment, and they had a contract for it back in February. Well, come March, they kept hearing next week, next week, next week, and they called me, and I got involved, and I got to the company and got to the University of Cincinnati and said, you know, what's the real problem here? And they said, well, we're being told by the federal government we can't deliver it to Cincinnati. It needs to go somewhere else. I said, well, they contracted for this back in February, and we are desperate for testing. We may not be a hotspot right now, but we're going to be unless we get some testing. So again, we broke through the red tape, broke through what was some miscommunication, it turned out, and with the help of the White House, we got the approval to get the diagnostic test there that had already been contracted for. It's called a Cobas 6800 machine. It can process more than 1,000 diagnostic tests per day, and it is working. And it is every day giving more people this sense of security that they know whether they have this or not, and they know whether the person that works in the store has it or not, and they know that we have more access to testing. Not enough yet. We're getting there. But that will be key to getting us back to business, but also reopening in a way that we don't have to stop if there's an outbreak, because we'll have the testing to be able to really throw at it, and then the contact tracing and be able to ensure that we can stop the spread of the virus. So those are some of the things that we've worked on. We've worked with FEMA to unlock additional resources for Ohio, and that's happened around the country. USDA has now allowed the Ohio Department of Job and Family Services to operate the Disaster Household Distribution Program. We appreciate them. We work with them on that so that we can efficiently get meals to food banks and families in Ohio. We worked with the Department of Veterans Affairs to ensure that veterans to get an extension on their filing of claims and appeals during this time period for veterans' compensation benefits and other benefits during a time when VA offices have been closed. We helped stop the Bureau of Prisons, the Federal Bureau of Prisons, from sending more prisoners to one of our hotspots. It's a really sad case, the Elkton Federal Prison in Ohio. We also helped them bring more health care to the Elkton Prison. Frankly, I'm discouraged that they aren't doing more testing there. I talk to them constantly, and they're providing more testing, but not enough. Not enough. And I think it's inexcusable. I think in a situation like a nursing home or a prison, we should be focused on getting the testing in there. These are what they call congregant living situations. In this case, it's a low-security prison, so it's more like a dorm-type style living. And unfortunately, if they were to test as much as they should, I believe they'd find out, as we found out in other state prisons in Ohio, that more than half the prisoners there are carrying the virus. And you've got to separate those people out from those who don't have it and do much more treating and tracing. But we've made progress there, and we'll continue to. The Phase 3.5 rescue package we passed a few weeks ago does have funding for the PPP program, which is for small businesses to be able to keep their employees and keep their doors open. It also has funding for health care. But the piece that hasn't gotten much attention, that may be the most important aspect of the bill of all, is $25 billion in the bill for more testing. Again, I'm a broken record here on testing, but that money is so important, and we're using it in Ohio right now. About $43 million has come to Ohio recently, I'm told. And that funding will be helpful, not just to ensure that we have testing, but that we have enough testing so that we can really get a sense of what's going on in terms of the healthcare crisis, and then when there is a hotspot, address it again immediately and be able to stop the spread of the virus. It's so important to us reopening and get people back to work, back to their churches and other places of worship, back to school. We need to get back to a more normal life, and we can, and we will. We'll figure this out. But we do need the help of having the necessary testing capacity, diagnostic testing, and then it's also helpful to have the antibody test so you know whether you developed an immunity or not. But those are both needed. Can't do it just with the antibody test. You've got to also know through the diagnostic test whether someone has the disease or not to be able to pull that person out of a situation where he or she is with others and to find out who they've been in touch with and do the contact tracing. And again, quarantining those people, not quarantining everybody else. That's the effective way to do it. Congress has now passed 4 of these legislative measures in an overwhelming bipartisan fashion. It's a lot of money. About $3 trillion have gone out the door from federal taxpayers. I hope we can continue to be bipartisan. Hope we can work together to figure out how to move forward. In my view, moving forward means looking at what we've done carefully. Let's not start to legislate again and spend more money till we know how what we've already sent works. The money is just being distributed now. In fact, most of our money in Ohio that goes to the state and local governments has not been distributed yet. Let's get that money out, by the way. They need it. They need it badly. They need it to pay police and fire and EMS. Our cities in Ohio are really hurting because they depend so much on income taxes, on earnings taxes. Other cities in America don't because they can't, but about 4 of the top 5 cities in America that are most affected by the reduction in revenue from the coronavirus are in Ohio: Columbus, Cleveland, Cincinnati, and Toledo. So they've got a real problem on their hands. I strongly urge the Department of Treasury to loosen up the requirements to allow that state and local funding to be used more flexibly, specifically for payroll, for public safety, based on Monday's guidance that we just got a couple days ago here. They can now do that. That's just guidance. It's not legislation. I would love, in whatever we do going forward, to get that in legislation, to say, let's provide flexibility to the states, but also to these municipalities. And I will tell you, in my home state of Ohio, again, at the municipal level, we are really hurting. Budgets are being slashed because the revenue is not coming in because it's based on the economy. Most cities rely heavily on property tax. We don't. Property tax has not been affected in the way that income tax has, or sales tax. So we do need to pay attention to this. And people say, well, we shouldn't send any more money to municipalities. Let's start with flexibility. Let them use the money they have more effectively for what they actually need. I don't want a situation where you've got a 30, 40% cut in police, which is what's happening in some of our municipalities, to affect the public safety of our communities at a time like this. These police officers need to be on the street doing their jobs. God bless them, they're out there, we need them. EMS personnel, if your grandmother needs to be rushed to the hospital, you want the EMS to come. You don't want to have a 40% cut in their services. So we do have to deal with this issue and be sure providing the flexibility is the first step. And let's codify that by statute. Make sure it's clear, not just guidance that doesn't seem to be consistent with the underlying law, because the underlying law says it has to be directly related to the COVID-19. And some of this is not. You need police officers on the street whether you had COVID-19 or not. So let's be sure we codify that, and then let's see what's needed. But I also think in this next legislation, we also have to be sure that we are not just looking at what's already passed, but looking ahead. And looking ahead means the ability to reopen. And that means stimulating the economy, creating, whether it's tax relief or whether it's smart investments in infrastructure. Let's say the projects that are already on the books in my state and yours, projects that are already shovel-ready because they're ready to go. They've gone through the merit-based process in our states. Many of those projects won't be able to be funded this year by our states. Why? Because their revenues have collapsed. Particularly their gas taxes have collapsed. So the state match, which is based on the amount of gas you buy, has gone down because people aren't driving nearly as much. What if we picked up some of that at the federal level? These are good projects because they aren't bridges to nowhere, because they've been through the merit-based process, and they're ready to go. That's an idea. Why? It's good jobs, one, which are needed right now, and good benefits, but also it's economic benefit. Those dollars will come back in terms of improved roads and bridges and ports, airports. Rural broadband would really help right now. As people are telelearning and teleworking more and more, they're finding out, oh my gosh, there are big parts of our country that don't have broadband access. Can't get Wi-Fi. If you can, it's way too slow. Again, talking to the Farm Bureau today, you'd think they'd be talking about the price of corn and soybeans, and they were, and the huge issues we have right now in the beef industry and the pork industry and poultry. But they were also talking about, I got my kids at home, and we can't do the homework because you can't get broadband in a lot of parts of Ohio. Probably about a third of our state, Ohio, not viewed as a state that has, huge, sparsely populated rural areas, but we have enough. And we have a real lack of access to broadband to be able even to do schoolwork, much less to start a small business. So this is another area where we could provide some help for that here, and it would come back in terms of increased dollars from having more economic development in some of these rural areas. So I think there's some things we need to do there as well. There's been a lot of discussion about this issue of liability protection. Let me tell you my perspective on this. It's very simple. This should not be a partisan issue. I mean, we should not want these hospitals and these schools and these small businesses and anybody to be able to be sued for something that was totally out of their control. This is not something anybody should be blamed for, certainly in this country. We know where it started, in Hubei province in Wuhan, China. But the fact that this has come over here and people are affected by it, let's not have a trial lawyer bonanza here, because that will result in people not getting back to work. It'll result in more costs for our universities. I understand some of them are being sued right now because they have students who are telelearning. Well, yeah, it's not their fault. You can't bring students together right now into dormitories. It's not safe. I know there's, again, kind of a partisan nature to this. It shouldn't be partisan at all. We should all want people to go back to work, to be able to go back to school, to be able to access the healthcare system. And I also think for my colleagues on my side of the aisle who might want to make this broader than the coronavirus, let's keep it to the coronavirus. And I think that's what people intend. Let's keep it to COVID-19. And let's provide the kind of protections, sensible protections that are necessary to be able to allow people to get back to a more normal life. People say, well, things are going to be so different now in America. They will be different. We'll be more cautious. We'll probably therefore have a less drastic flu season too, because we'll be more careful. And with this pandemic, we don't know if it's going to come back again like it did a couple months ago. Will it come back again in the fall or the winter like that? But we have to be prepared for that. So life won't be exactly the same. There's no question about it. And there'll be some things that'll be different too. There'll be more teleworking because it's worked well. It's cost effective, it's efficient. There will be more telemedicine because it's worked well. I've talked to a number of doctors who are actually very pleased with some of the things they've been able to do remotely. I hope we'll have a Congress that works more remotely. So when we're on our recesses, as we do every August and as we do periodically, that we could have remote hearings on a more regular basis because it's great information. But ultimately, I think our country will get back on track. Again, we as Americans, when we get knocked down, we get back up on our feet. And that's what we will do. And we will again have not just the greatest economy on the face of the earth, but we again will be that beacon of hope and opportunity for the rest of the world. People will again look at America and say, I want to be like that. And we'll be able to show that in how we get back on our feet and how we get back to a more normal life. And once again, on the greatest country on the face of this earth, we'll be able to, once again, be able to show the world an ideal for everyone to aspire to. Thank you, Mr. President.